Nights in a 5-star hotel. I mean, I haven't had a holiday for like 8 years without my kids. It does sound really appealing. Palm trees, blue skies, and obviously a very nasty wound.
The fact that you're going abroad, you're not going to be having a great time sitting on the beach after an operation like this. It just doesn't happen. And actually, it's quite risky, not least of all because you've got a long flight. And Malaysia is probably one of the furthest places you could think of going. And, you know, even on long flights, when you don't have surgery, there's a high risk of getting a deep vein thrombosis. And that's much more if you've had surgery. So I think you probably picked the best combination for a bad outcome.
Oh, great. I can't believe you've said that. So what I need to do is just go away and see if I can make the benefits outweigh the risks.
Or unless you can move Malaysia to some part of London that I've not come across, possibly not.
I know what everyone's saying. I know they're totally against me wanting to do this, and I know all the advice is out there, and there are like loads of risks. But I really, really want to do it.
Hi, Nikki.
Hello.
This is Nikki.
Nice
Pleased to meet you, Nikki. Come sit
I'll
here.
leave you in his good hands. I'll see you well.
Thank you.
Now, before we start, do I call you Miss Taylor, Nicola, Nikki?
Call me Nikki. Nikki is fine.
Nikki, all right. You call me Dr. Soma. Don't we all?
My surgeon, Dr. Soma, checks my medical details and shows me some of his previous work.
You see the stretch marks there?
Yeah.
These marks are down here now. All right. Does this satisfy your expectations?
Yeah, that's fine.
Okay, Nikki, I need to examine you.
He needs photos to plan the surgical cuts to my overhanging apron. He's designing the new, younger-looking me.
Is that my droopy?
And I want my eyes done too, but there's a problem. Dr. Soma has discovered a lump.
Oh, you got a lump there.
Yeah, it's a little.
It's a sty.
Yeah, but like months.
Oh, we have to remove it first, you know. We can't do the eye operation with an infection going on there.
Really?
No. I know you're upset about your eyes. I'm sorry, but I can't take a risk. Sorry.
I'm gutted about my bat eyes. They really scared the kids. Just hours later, I'm booked in and being prepped for my op.
It's all becoming a bit real now, isn't it?
In theatre, Dr. Soma limbers up for the job ahead, the battle of the bulge.
Right, just 100% oxygen. Just breathe normally for me. All right?
I'm marked up like a best cut, and my apron gets tugged to see how far it will reach.
Body.
And then it's the scalpel, the beginning of the end for my tum. It's an hour before enough cutting and slicing has finally rid me of my apron.
This is the skin and fat that was there below the umbilicus.
That's belly button to you and me. Thank heavens they've left it behind to be reattached. Like a scene from Hannibal Lecter's kitchen, my former apron weighs in at 2 pounds. The stitching is along my old caesarean scar. At least it'll be knicker-friendly. An hour and a half after the first cut, and the team proudly pose with my new flat tummy. The following morning, I'm feeling not too bad.
I feel a bit hungover, but it doesn't. That bit doesn't hurt unless I cough. Then it's a bit painful. But it feels a bit like when I had a caesarean, actually.
Hi, Nikki.
Hello.
It's time for Dr. Soma's daily check.
How's last night, sleep-wise?
It was fine, actually. I woke up now and again, but I slept like a baby.
Great. How's the pain situation?
It's fine.
And he has something he wants to show me.
You sure you don't want to see this, Nikki?
No.
That's all the muck, and that's your skin.
Oh, God.
Done. So now, do you mind if we dispose of this?
Please do.
Right on?
All right.
Whenever
I'm told to get out of bed today, move around to prevent blood clots. but I've got to do it bent over.
Okay.
And walk like that. Never
Right.
ever straighten up.
Okay.
If you do, things go ping, 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 ping.
Okay. Thank you.
Over the next 4 days, it becomes clear to me just how major the surgery has been. Even getting to the loo is a struggle. My drains go everywhere I go, removing waste blood from my wound. I'm certainly not feeling any younger at the moment. Mainly my days are spent feeling wasted, laid up inside the hospital. But Dr. Soma reckons that it's all coming along nicely.
You can have a look now.
I don't want to look.
You have to have a look. Come, just have a look, yeah.
Lovely.
Oh, it looks great.
Does it look infected?
No, of course, no.
Great.
No, umbilicus is fine, the belly button is fine, the scars are fine.
That's all I care about, yeah.
Everything's good. All right?
Good, good, good.
So
It's a huge relief to know there are no complications. Soon after, I'm discharged from the hospital to start my holiday. Well, maybe tomorrow. 5 days later, I'm back at the hospital for the results of the op.
Can't see my smile now.
I'm thrilled with my younger-looking nip-and-tucked tummy.
Fantastic, that's it.
It's not been much of a holiday, but so far the surgery seems a success. Just the flight home to cope with.
Okay, have a safe journey back.
Thank you. It's lovely to meet you, and hopefully, again, I'll come back and have my eyes done.
All right.
Okay.
Let me get the door. Good.
See
There
you.
we go.
Bye-bye.
Bye.
Oh my goodness! Look, welcome home! Coming home, I wonder whether I'll get the reaction I'm hoping for.
Hey, do you want to have a look at
My gosh, don't you look thin? Oh, yes.
Are we twins?
But do you notice the difference
I do. Nicola, there is a difference. There is a difference.
from the side?
Absolutely, yes, lovely. Yes. Oh, I'm most jealous.
Well, maybe we can take you and Granny done too.
I think that's a yes then. A definite thumbs up. A week after I get back, I arranged to meet some old friends and some new friends for a celebratory drink. Do they think I look younger?
We're the skin team.
Yes.
And we're the skin deep people. We think you look great.
Do you?
Yeah, no, your skin looks fantastic. And you must keep going with the Retin-A
I will not stop using
because that can only continue to help.
And your peels. And I love peels.
Yeah.
The anti-wrinkle experts think it's all been a success. But what about someone who really knows me? My mate Nell.
You look, like a curvy sex kitten, and your skin does look fantastic. I just don't remember it being that much.
Can you not remember beforehand? Can you not remember the big...
Maybe I never looked at your tummy that much.
I don't think you...
I've seen you naked, and I...
Do you?
Nell's reaction has knocked me back a bit. Have I just got carried away with this anti-aging stuff? But remember how I looked at the start? Flabby-tummed and saggy-eyed. I love the new me. I feel more confident, and I confess I've been seduced by the rejuvenating process.
Should I just take my whole top off?
And now I really do want more treatments. There's even a risk I'm becoming obsessed. But is it right? Should I be so wrapped up in my looks? Should I care so much about my body? And I'm feeling guilty about all that money. After all, none of these treatments are forever. So I'm worrying about where all this self-obsession could lead. Oh well, I'm going to enjoy it while it lasts. And perhaps I'll take my daughter's advice. Concentrate on the beauty within.
I don't want to grow old. I don't want to turn wrinkles.